Okay, so in today's lecture we discussed about hemostasis. What is the definition of hemostasis? Arrest of bleeding is called as hemostasis. Hemostasis, to arrest the bleeding is called hemostasis. And in hemostasis we need to know three important terms. One is properties of platelets. What are the three properties of platelets? Adhesion, aggregation and agglutination. Then phases in hemostasis. Hemostasis has three phases. One is vasoconstriction, that means lessening of the diameter of blood vessel. Then platelet plug formation, followed by the third phase is clotting mechanism. Okay. Then you need to know the properties of blood vessels. We have two properties, vasoconstriction and vasodilation. With these three ground knowledge, we will discuss about hemostasis. So hemostasis starts with the damage to the blood vessel. So whenever there is a blood vessel damage, damaged blood vessel will expose the collagen fibers, and this exposed collagen fibers also these endothelial cells will release a protein called 1 milligram factor. Now this 1 milligram factor will deposit on the surface of collagen fibers. Now the roaming platelets will get activated and they will get attached to the 1 milligram factor. In some instances, some patients might have deficiency of this 1 milligram factor, hence results in a condition called hemophilia, which is a bleeding disorder. But in normal conditions, platelets will bind to the 1 milligram factor with a receptor called GP1B. With the help of this receptor, a platelet will bind to the 1 milligram factor, and that is the first property of platelet, which is the adhesion of platelet. Upon adhesion, now this platelet will get activated, and activated platelet will release some cytokines. That cytokines will trigger the sympathetic nerves to release serotonin, and serotonin will cause the vasoconstriction. Vasoconstriction will decrease the blood flow to the site, hence decreasing the bleeding. Now, this activated platelet also releases two important chemicals called ADP and thromboxane A2 along with platelet activating factor. These platelets will call the other platelets to aggregate at the site of bleeding, and that is the second property of platelet, which is the platelet aggregation. Upon platelet aggregation, they will temporarily prevent the bleeding, and they will form a plug called platelet plug formation. Upon platelet plug formation, now these platelets will start converting fibrinogen to fibrin, resulting in clotting of the blood. So this is the complete picture of hemostasis. In some patients, there will be a deficiency of 1 milligram factor, results in hemophilia. Some patient platelets will have GP1B deficiency, results in a disease called Werner-Solier syndrome, and some patients GP2B3A will be absent, and that results in a condition called Gallman's thrombasthenia. Okay. Then I also discussed about the role of bleeding time and clotting time. Bleeding time always emphasizes about the platelet activity. If there are less platelets, bleeding time will increase. More platelets, we need not to worry. Then clotting time will increase due to absence of any clotting factors, and the clotting factor we will discuss in the tomorrow's lecture. So this is all about the hemostasis. Thank you very much.